Hi, I'm Brian Burnikel from the Steadman Hawkins Clinic of the Carolinas and Medical Director for the Center of Joint Replacement. Today I'd like to talk to you a little bit about what's involved with getting a knee replaced. At this point, you've made the decision to proceed with surgery, and that decision is usually based on the level of pain that you've been experiencing as well as your level of function. A lot of times what we see is as the pain increases, patients have to eliminate certain activities that they enjoy to do. The reason for doing the knee replacement is to allow you to return to those activities as well as to decrease the pain that your knee is feeling. When we do a knee replacement, there's a couple different types of anesthetic that we can use. The most common type of anesthetic we use is called the spinal anesthetic. With the spinal anesthetic, you're numbed up from the waist down. You can also sleep during the surgery. The anesthesiologist will give you a sedative so that you really aren't aware of what's going on during the surgery. We also use a new device which is called the femoral nerve catheter. The femoral nerve is the nerve that supplies the sensation to the front part of your knee. This is the part of the knee where we make the incision. So this catheter supplies the numbing medication and will keep the incision area numbed up for approximately 2 days after surgery. This has significantly improved the patient's recovery and significantly decreased the level of pain that they have after surgery. Well, what is it we exactly do when we're doing a knee replacement? A lot of patients think that we replace the entire knee joint. You should really think of a knee replacement as a knee resurfacing. We're putting a new surface on both sides of the joint, and it's the surface or the cartilage that has worn out and developed into what we call arthritis. This is a model which illustrates the portion of the joint that is resurfaced. The plastic here represents the bone. This is the bone of the thigh, which is called the femur. This is the resurfaced material, which is called the femoral component. This represents the lower bone, which is called the tibia. This is a titanium surface that is cemented into the tibia, and then a plastic insert snaps into the titanium base plate. It's the femoral component that rubs on the plastic surface in your new knee. We also, in some patients, will put a new surface on the patella or the kneecap. Some patients have a lot of arthritis in the kneecap, and in that situation, we'll resurface the kneecap. If the cartilage on your kneecap is perfect, we'll leave your kneecap alone and allow your own kneecap to rub against the implant. Even if your kneecap is resurfaced, you still have a significant portion of your own kneecap. There are several different techniques that we can use for your knee replacement. One of the techniques is to use computer-assisted surgery, and we do those in special circumstances. Another fairly new technique is to use the Visionaire custom instrumentation system. With the Visionaire custom instrumentation, a limited MRI scan is done of your knee, and from that MRI we can get a three-dimensional image of both of the bones in your knee, the femur bone and the tibial bone. From those images, and also some long-standing x-rays that we'll get before surgery, a custom block is built which fits specifically onto your bone. And what this block does is tells us the correct position to place your implant. It also tells us the correct size of the implant that is going to be best for you. We also have a block which is made which fits on the tibial bone. This block does really the same thing. It tells us the correct position for your implant, it tells us the correct size, and it also tells us how much bone should be removed in order to fit that implant in place. Now, the implants are not custom, it's actually the instruments that we use to do the surgery that are custom made. As you can see from this model, it's actually a fairly small amount of bone that's removed during the procedure. After the procedure is complete, the incision is closed with stitches under the skin, and then staples will be placed on the skin. The surgery itself usually takes about an hour to complete. After surgery, the patients will be in the recovery room for approximately an hour, and then they'll get to the floor. Most patients will get up the day of surgery and at least sit up or maybe walk a little bit. By that time, it usually feels pretty good to get out of bed and start moving. The nurses will take care of your pain medications, and you'll need to request when you need pain medications. You will get some pain medications routinely. Other medications are called PRN medications, which means you'll need to let the nurse know if you need any pain medication. You also may experience some nausea after surgery. In that situation, the nurses will be able to provide you with medications to counteract that as well. It's important for you to know some of the risks that can occur with surgery. Infection is probably the thing that patients worry about most. Fortunately, infections are rare and can be treated, but it may take intravenous antibiotics and a couple more surgeries to clear that infection. Another thing that's a concern to both the patients and the surgeon is blood clots or deep venous thrombosis. These are not rare in occurrence, but significant blood clots are fairly rare. You will be given a blood thinner, sometimes during and then after surgery, to decrease your risk of blood clots. You will also be using sequential compression devices, which are the plastic leg sleeves that squeeze your knee or your lower leg sequentially to keep the blood from pooling. We also get our patients up very quickly, and that's probably one of the most important things in preventing blood clots. The nurses and therapists will also review some exercises with you, and these exercises are partially designed to keep your blood moving, keep it from pooling, which can allow the blood to clot in an abnormal fashion. When you're in the hospital, you'll be doing physical therapy twice a day. Each day you will gradually progress as far as your range of motion and your ability to ambulate or walk. Prior to your discharge from the hospital, you will be able to ascend and descend stairs, and this is kind of your graduation point. You'll know when it's about time, when you're about ready to leave the hospital, when you're able to accomplish those goals. Most patients are in the hospital 2 to 3 days, and at discharge, we'll also be getting physical therapy at home. I hope that this video has given you valuable information regarding your knee replacement surgery. Please feel free to ask any additional questions, and good luck with your procedure.